Everybody's concerned about the breaks of services. Whether you are doing a press conference with unions, whether you're doing a press conference with mayors of small towns like we did yesterday, everybody across Quebec, every citizen is worried about breaks of services. So I'm certainly happy that everybody is getting involved in this file, that the nurses unions, that the small town mayors, that people across Quebec are getting involved and are telling the message to government that we cannot accept a government that simply says, oh, well, it's a pandemic, it's hard, we're going to decrease services that are available to citizens. It's not acceptable to have emergency rooms that are closed and people have to do 100 kilometers to get to the nearest emergency rooms. It's not acceptable to live in a region where your obstetrics unit has been closed for a year and a half. It's not acceptable to have not to have those services and to have cancer patients, as we learned this morning, who are waiting twice as long for their surgeries. Government has to prioritize according to the needs of the citizens, and when you have a health minister who tells us over and over, I will not let down cancer patients, and then you learn in the paper that they're willing to have twice as long a wait, quite honestly, I'm just happy that everybody's finally getting involved in this file and making sure that government is pressed on the issue so that we can provide better services to citizens.
But it's October 6th right now.
Yep.
What are you asking the minister, the health minister? Like, do you know what's going to happen after October 15th?
I certainly hope the health minister knows what's going to happen after October 15th. There is going to be a number of, if the minister follows through with his guidelines, there are going to be a number of healthcare professionals who will not be in our hospitals, in our long-term care facilities, in our healthcare facilities. But the minister never told us, I expect there to be X amount of employees less in long-term care facilities, X amount of employees less in hospitals, and this is my contingency plan. This is how I'm going to make it work. That's what we want from the health minister, is to give us an adequate picture and then say, I have a plan for it to make it work so that patients can get the services that they need, or I have a plan to really convince these people that they do need and they will get the vaccine so that they can continue to offer services. Those are the things we're looking for from government at this point.
Are you asking for a period of grace for the ones who did receive their first dose already?
We're asking for the government to be honest with Quebecers as to what's going to happen at that date and to come up with a plan so that people can get the services that they need.
What would be your plan if you guys were in power?
Well, our plan would have started a whole lot earlier. To be honest, the minister it seems that he caught himself off guard here. My colleague mentioned it a second ago, but we could have increased the working conditions for nurses a long time ago so that we are not in the situation we're in. The minister says, I don't want to close any more services. He said that 2 weeks ago, and then he never dared repeat it. The premier didn't dare repeat it. He could have put in, he could have canceled mandatory overtime so that nurses feel comfortable coming back to the network. He could have given them better working conditions. He could have applied the better ratios for patients to nurses. Those are all things that could have been put in place, that should have been put in place, and that would make sure that we're not in the situation we are now facing these days.